I will skip the resistant part as this one was covered by my colleague, and then due to the interest time, I'm wanting to move into the HER2 space. So HER2 have a number of different names. It's called HER2. It's also called ERBB2. It's actually a sibling of EGFR, as they have a very similar structure function as transmembrane domain receptor. HER2 mutation occurs in around 2 to 3% of non-small cell lung cancer patients, and with YVMA to be the most common insertion mutation. We have in HER2 currently under FDA approval for second-line treatment. However, the last couple of years, the development focus has been developing HER2 small molecule inhibitors to the frontline setting. There are two medications, BER-88 and zongertinib, both had excellent preclinical data, and then they entered clinical evaluation. Last year, we reported BER-88's data for previously treated HER2 non-small cell lung cancer patients. As you can see, this TKI is highly efficacious with a response rate of 72%. Similarly, zongertinib also entered their phase 1 study showing similar or potentially even superior benefit of a response rate approaching 70%, and then the progression-free survival at the time of report not being reached. The toxicity of those two drugs are similar to what we know about EGFR and the HER2 on-target toxicity. BER-88 have a little more diarrhea, and the zongertinib has a little higher liver function toxicities. Currently, we're hoping to bring BER-88 and then zongertinib at least first in the second-line setting to give our patient additional option. And in the meantime, there are global trials ongoing evaluating either of the drug in the frontline setting in comparison to chemoimmunotherapy. Both of the trials' primary endpoint is progression-free survival. With that, I will conclude the HER2 part. Currently, we have in HER2 as the only targeted therapy, although it's an IV form. We are, as a field, developing rapidly novel oral medications, potentially in first-line setting, to add additional options for HER2 patients and prolong our progression-free survival.